Okay, Assalamualaikum. Hi, everyone. For those who are fasting today, Salam Ramadan. And for the rest of you, thank you so much for joining us. Before we begin, kita nak tunggu dulu. We want to wait for more viewers to tune on. So please share this live video because today we will be discussing about hypertension and the heart. So dengar orang kata, don't make my blood go upstairs.
Very classic.
Very classic one. So we want to talk about hypertension. So before I introduce our moderator for today, our speaker for today. Puasa. Before I want to introduce, before that, let us know down below where you watching us from, daripada mana, what are you guys doing right now? Are you on lunch break? And also, please share with us if you have any questions at all. We will read out your questions for Doctor to respond to your questions. And also, don't forget to subscribe to our YouTube. Kita ada YouTube tau sekarang. So please, yes, we have a YouTube channel. So we will be publishing or upload this live video on our YouTube channel. So if siapa yang dah lambat masuk ke apa ke, you can always go to our YouTube channel, which is Maaedicare, and you can subscribe. Like us there, follow us there, and share our live videos yang kiranya rerun lah orang kata, recorded videos. So maybe pukul berapa dah? Okay, now tepat pukul 1, so maybe we can begin now. So, Assalamualaikum warahmatullahi wabarakatuh, and hello everyone. Hi Doctor, say hi.
Hello, Waalaikumsalam. Sehat, Nani. How are you?
Alhamdulillah.
Alhamdulillah.
Alright, so today we will be talking about, let's talk about hypertension and the heart. So our speaker for today is Dr. Nik Mohd Adzrul. Hi Doctor.
Hello, hi. Hello again.
So hello again. So this is actually volume 4. Dah 4 kali dah. 4 times we've done this live before. So this is the 4th time. So to all of you that's watching right now, Dr. Nik is actually the head Cardiac Diagnostic Centre from Maaedicare. So maybe Doctor, before we begin, while waiting for others to tune in, maybe you can share with us just a little bit about Maaedicare.
All right. Okay, initially Maaedicare Charitable Foundation started way back in 1994 as a charity dialysis center to cater for the underprivileged group of people who need dialysis. So throughout these 20 plus years, they've expanded from one center in KL to about 12 centers all over Malaysia. So after the success of these dialysis centers, they were looking into what other area in health which they can help out. So after doing some study, they decided the people with heart conditions need help as well because of the long appointment, long queues in government hospitals. So I think they thought the management and the board members thought that it's the right thing to do to set up a charity heart center with similar model like the dialysis center. So we were open in 2018, September. That was the first time we opened our doors. So right now we are approaching our 4 years of 4-year birthday this September. So we are a non-emergency heart center catering to diagnostics and early screening of heart, but we also do procedures like echo, stress test, Holter, angiogram, angioplasty, and also X-ray and CT scans as well. So despite focusing on underprivileged, everyone is welcome to come here for diagnostic and early screening and treatment. And we have cardiologists. They are basically renowned cardiologists from private hospitals like Gleneagles, Prince Court, Avicenna. So they come here on a charity basis as well to see our patients here.
Right, that's amazing. That's really great. And also, if you want to know more, you can always follow us at visit us at www.maaedicare.org. Okay, so if you want to know more about us. Okay, Doctor, since ramai dah juga yang join ni, again, thank you so much for joining us. For our viewers that have just joined us, again, we would like to know who are you? Siapa di bawah tu, komen lah kat bawah. And if you have any questions at all, please ask away. Okay, so doctor, let's begin our topic today. What is actually hypertension or high blood pressure?
Okay, so as you said, high blood pressure. First, before we define high blood pressure, what is the normal blood pressure? What is actually blood pressure? I think people mention my BP, my BP is this, my BP is that, but so this is an opening for me to actually explain what exactly is this BP that we're talking about. So this blood pressure is actually the pressure inside our blood vessels and how hard the heart has to work. Means that if it's in a normal range, so the blood flows in a normal range, normal velocity, the heart is pumping normally. So this person, due to the normal blood pressure and the normal pumping of the heart, has low risk of heart disease. But if let's say the blood pressure is elevated, so the heart has to work harder to pump, and the vessel have to be maintained with a lot more force than usual. So a normal blood pressure, normal BP, is usually at the range of 120/80. And if it bypasses the 140/90 mark, then we call it hypertension.
Right. So yeah, maybe that's the thing. I think Rama is currently young. Actually, say that, oh, my BP is really high. Don't make my blood go upstairs.
Yes.
Right. So actually, if it's 140, it's already considered as hypertension lah.
Yeah.
So actually, doctor, why does it occur, and what are the risk factors of hypertension?
Okay, and when it comes to hypertension, we have the primary hypertension, which is hypertension without being caused by a certain disease, and also the secondary hypertension, which is in contrast to the primary hypertension, is actually the elevation of blood pressure due to certain disease which has already existed in the person. So primary hypertension, or we call it essential hypertension, it can be due to persistent stress, and then obesity, and then the uncontrolled diet with lots of salt, lots of sweets, lots of alcohol, and then having sedentary lifestyle, not exercising as recommended, and then the smoking habits. These all can contribute to primary hypertension. So this is the first category of hypertension. Then the secondary hypertension, they are a complication of other disease. For some people, some diseases appear first before hypertension. For example, kidney disease, chronic kidney disease, they can actually lead to high elevation of blood pressure as well. Similarly, some patients, they develop heart disease first due to the obstruction of the vessel inside the heart. So from the heart attack, the blood pressure becomes very high as well subsequently. And yeah, that's about it as well in terms of what can cause, what are the risks of getting hypertension. So they can also be due to other factors, like for some women, their BP is normal beforehand, but when they get pregnant, occasionally their blood pressure goes high due to their pregnant conditions. Most women, after giving birth, their blood pressure returns back to normal, but we do have to monitor them, so because they have a little bit increased risk of getting hypertension in the future. And then stress, improper sleep, they can also contribute to hypertension as well.
Right.
Okay.
So doctor, there's a question here asking,
okay.
Can anyone get hypertension? I think you're about to wrap up on the risk as well. Risk also.
Okay.
Who are at risk, and actually, can anyone get hypertension, doctor?
Okay, I mean, no one is immune from hypertension if they don't take care of their health. So they have certain factors like age. They are more common in older people compared to the young ones, but this was basically a textbook criteria from before.
Right.
Nowadays, due to lifestyle, due to stresses like traffic jams, stress at work, sometimes some people being pushed to work beyond their working hours, which causes them to lose sleep. So we do see them happening in young ones as well. I've seen, even though the textbook says that those are more than 40 years old, more than 60 years old were at risk, There are some people who are having hypertension even as early as mid-20s, 30s due to the nature of their job. And then weight. Those who have higher BMIs tend to get hypertension far easier compared to those who have normal BMIs. And then those who smoke, those who take a lot of alcohol beverages, they tend to get hypertension as well. And then it's one of the more textbook risks. The males get hypertension more than females, according to the textbook. But nowadays, I think females go out to work just as much as males, so the risk sort of even out as well. And then it depends on their existing health condition as well. So if they are having heart disease, they're having diabetes, kidney problem, cholesterol issues, and these can contribute to them getting hypertension far easier compared to those who are perfectly healthy.
Right. Okay, that was the question from Ada Lini. Ada, thank you so much for the question. And again, for those of you who have just joined us, please let us know what are your questions so we can ask the doctor straight away. Okay. So, okay, doctor. As you said, sometimes I think there's no symptoms for people who have hypertension. So how do we know that we are actually, because right now I'm in my mid-30s, and I've heard so many of my friends that actually, and women that actually have very high BP. Like it's normal for them to have like 140, 150, very, very high BP. So how do we know if we check kan? So what are the symptoms?
All right, okay, as you mentioned, some people can go without symptoms for many years before the symptom finally kicks in. Usually when the symptoms kick in, it's already on the high side compared to the borderline high. So let's say if you don't have that BP machine to check at home, some telltale symptoms like that you can be suspicious of if you have it, it's like headache, giddiness. Usually the headache is at the back of the head rather than in front. Front can be because of other reasons, or if it's a headache only on one side of the head, then it's not really hypertension criteria. But if it's happening at the back of the head, then it might be hypertension. Then you might have giddiness, your vision becomes a bit blurry on and off. If blurry all the time, then usually it's a trip to the optician is what you need. But if it's a on and off blurriness, then you have to suspect it might be hypertension issues. And let's say if you have a neck stiffness, back of the neck stiffness, this also is a telltale sign of hypertension as well. So I think it's important now that BP machine is more and more accessible and more affordable in pharmacy. You can always get one to be parked at home. Just check it every once a week to see whether the BP is normal or not. So let's say if you get a persistent reading of 140 over 90 and more, a trip to the nearby GP or clinic is probably what you need in order to screen the symptom even more.
Right. So when is actually the right time? We're going to talk about treatments later on, but then, normally, sometimes if we were to have a very high BP and it's consistent, but sometimes, when is the right time where we have to take the medication?
Medication, all right, okay. Usually, if let's say we have a persistently high reading of a reading like 150 over 100, which is even more than the cutoff of 140 over 90. So if you keep having this kind of reading, let's say every day, or the reading has not gone down despite you are relaxing after a full night of good sleep, the BP is remaining 150 over 100. Despite having no symptoms, it's best if you start to take the medication as advised by the doctor. Usually you can just let the doctor know, this is my trend. Let's say if you're doing it at home, this is my trend at the time of which time of the day. Usually if you take it after a long day of work, then usually the reading is not really as reliable as the one that you have taken first thing in the morning, because that's when you are rested, you have not encountered the daily stress, the traffic jams, maybe your boss or colleagues or friends are triggering you in some way that particular day, so your BP, like you said, I went upstairs.
Right.
Yeah, so at the end of the day, I would usually say maybe you should take a BP in the morning and we see how it goes.
Right.
sometimes the BP, I've seen cases in the clinic where the BP, in evening clinics where patient comes in saying that, oh, my BP, I've checked it just now, is 160 over 100, 150 over 100. Then I was asking them, do you have any morning BPs? They say, oh, it's not really convenient for me to check in the morning, but I will try. Then the next morning they came by, oh, my morning BP is actually 120 over 85. Then it's
I
okay.
see.
So we know it's stress induced, it's resolved with vitamin at home and rest. I have a complete rest at home.
I see. Yeah. Some of my friends do. They tell me like if they visit to the clinic, then it's high BP. But when it's at home, it's like okay lah. So maybe it's the stress of like being there in the clinic, people taking your BP. Okay, and that leads to a question like and there's also a viewer question by Puan Yati. It says, is regular heartbeat or palpitation related to hypertension or heart issue?
All right. Yes, I would say palpitation can be because of many things. It can be a heart issue, which is physical issues. It could also be a psychological issues. I think we've addressed this in the previous Go Live. If it's psychological, it means that you have to check for physical first. Means that if you feel that it's palpitation, you feel that the heart is racing faster than usual, so a trip to the GP is what you need to do to check the pulse. And then you have to do an ECG just to see how's the pattern. If everything is normal, the doctor don't think that it's actually heart related at all. So then we will explore the psychological aspect. Are you stressed or depressed? Or is there anything that you think about that triggers the rapid heartbeat? Which also brings back to that thing that you mentioned earlier about person. If the BP is measured in clinic, it becomes high, but if it's done at home, it becomes normal. This is also quite psychological, actually. We call it white coat hypertension, related to the white coat the medical team always wear.
Right. When you see someone in a white coat, you get you get anxious and your heart starts to race.
Normally, yeah, people have it because they have to go on stage to deliver a speech to a crowded room. Those who have to do presentation, they get what you call it in Malay, darah gemuruh. So this is also something that is more psychological than physical. But of course, if it's heart related, like arrhythmia, these are the things that we need to screen further using several methods like a Holter scan, whether to see whether it's a persistent arrhythmia or on and off. Then we can take the treatment from there on.
I see. Yeah. We have mentioned about this the previous Go Live, Doctor? Yes. Maybe for those of you, you can also check us out on our Facebook channel. There's the video section. You can look up there. Maybe I think it's volume 2 or 3. We have quite a lengthy discussion on palpitation, anxiety, and whatnot. How does it relatable to heart diseases? Okay, so speaking of heart diseases, what is actually hypertensive heart disease, Doctor?
All right, basically to make it very simple, it's the heart disease that results from a long years of hypertension. We're talking about 5 years, 10 years of uncontrolled hypertension. This can evolve into heart disease because the heart, like I mentioned earlier, the pressure keeps on increasing. Means that more force is needed to pump the heart. So eventually, if let's say I think we mentioned doing all the way to from the first Go Live about hati, jantung jadi satu. In one of our Malay discussions, so basically, higher pressure leads to more force needed to pump the heart. So eventually the heart, when you put a major force to pump it, it becomes bigger and bigger. So the muscle becomes swollen or
becomes sado.
But we don't want that. We don't want that for the heart. We want that for our bicep or tricep.
Right.
Not eventually a heavy heart is basically it's heavy. It fails to function as usual. It fails to pump blood out of the chambers as effective as before. So we call it heart failure, which is one of the more common symptoms of hypertensive heart disease. And then we have the heart attacks, which can happen after long years of hypertension, uncontrolled hypertension, because usually it has some factors like the vessel becomes obstructed by cholesterol or because of the high sugar level in the blood. So this contributes to the blockage of the heart vessel. Then plus hypertension causing burden to the heart attack can happen, and eventually it leads to a sudden heart death, sudden cardiac death, where the heart stops functioning altogether. And also, like our viewer mentioned, arrhythmia, that can also happen due to the expansion of the muscle. So the electricity that is conducted in the muscle tends to become a bit haywire than usual. So we get arrhythmia instead of a normal heart rhythm. So these are basically one of the common conditions that we call in general as hypertensive heart disease.
Right. So this is basically the worst case scenario that will happen if you were to ignore persistent high blood pressure, hypertension.
Yeah.
Okay, so what are the symptoms of hypertensive heart disease, doctor?
Yeah, basically it relates to the conditions that I mentioned. So they can get chest pain, they can get shortness of breath, they can get palpitations, giddiness, fainting episodes, and then what we call as reduced effort tolerance. This is related to heart failure, where previously when they were healthy, they can actually walk fast from one place to another. We're talking about maybe from your entrance to your kitchen. It doesn't take any effort at all for you to walk. But when we call as reduced effort tolerance, they cannot walk a few steps without having to stop to collect their breath again, because they feel breathless, they feel heaviness on their chest. So this is something that we call as reduced effort tolerance. They cannot lie flat because they feel like as if they are drowning, they couldn't breathe. These are the symptoms that they have hypertensive heart disease.
Right. Listening on the symptom pun dah makes me feel like
Okay.
So but how serious is actually hypertensive heart disease?
Very serious. I mean, when a hypertension is just on its own, it's a solo hypertension cause, it's easier to treat compared to when after many years of being of ignoring the high BP, suddenly it develops into a hypertensive heart disease. This is considered permanent and very difficult to reverse. Like a heart failure, once it's there, it's there. All we can do is actually to just make sure it doesn't get any worse anymore. So it's always better to prevent, or if let's say you have hypertension in the beginning, get it sorted out first before it becomes hypertensive heart disease.
Okay, so speaking of hypertension again, there's a question by a viewer. Do menopause women are more prone to get hypertension, doctor?
Yes, I would say yes compared to younger women and also compared to younger males. But if it's just menopause, and otherwise if the woman is healthy, taking care of her diet, usually it's not really a too significant risk factor. Usually it's more of a combination. If let's say the menopause women so happen to have high cholesterol compared to a menopausal woman without a cholesterol issue, so the risk is higher for those who have high cholesterol issues. So I would say it's a risk factor, but it's not as bad as other risk factors as well.
Right. Like the risk factors that you mentioned before. Okay. So yeah. Have I asked? Did I ask risk? Lupa pula kan. Who is at risk of hypertensive heart disease?
Okay, so basically the first two will be those who have hypertension and those who have heart disease in the beginning. So then we have those who have high cholesterol, high diabetes, they are a person with obesity, and then they are older than 45 years old, then they smoke or use various tobacco or vape products, they eat a diet very high in salt, they drink alcohol excessively. So these are the usual risk factors. Similar to those who have hypertension, diabetes, the risk factor remains the same for hypertensive heart disease as well.
Right. So can it be cured actually?
That's the thing that I think we mentioned it earlier, that how serious is hypertension heart disease. So once it's there, it's sort of like we just control it from becoming worse. Let's say the heart failure, usually it's there to stay because it's something that has been going on for many years. By the time that we have the symptom, it's already a bit too late to mitigate. So it's more like we give some medicines to help from becoming worse, and the person can actually still do preventive measures like exercise, stop smoking. So this will stop it from becoming worse. And with the combination of medication, the person actually can have a good quality of life still, depends on the staging. If let's say it's very severe, then unfortunately, all we can do is just to control to not make it worse.
Right. So having said that, what are the treatments for hypertensive heart disease?
All right. So firstly, we have to control the existing conditions like high BP, use high blood pressure medicine, and also diabetes. We have either the tablets or the insulins to control the sugar in the blood. Also with obesity, a person with obesity, they will need support in order to get back to their normal BMI. Because usually a person with obesity, they encounter a lot more stigma, difficulty in managing their weight. So it could be also some health conditions. So they need more support in order to get back to the normal BMI. Those with lung disease, those due to heavy smoking or using vape, or even. So if they stop, usually within 1 year and 2 years, so the risk will become lower compared to if they are continuing with the habit all the time. Because whenever they start to smoke, all the toxins will go inside the bloodstream and starts to harden the vessel inside our heart or other places. So they are more prone to heart attack. They are more prone to stroke, as we discover. So stopping all these things and get back to a healthy lifestyle will help them. For those who are already diagnosed with hypertensive heart disease.
Right. So yeah, I think the key point here with any diseases is just stop smoking, eat right, sleep right, live a balanced life. Susah juga kan. But yeah, it sounds so simple, but perhaps it's not that easy.
Betul.
Kalau tak, kenapalah tak semua je, ramai je orang kan. I mean, it's like how many billion people are suffering? 1.30 billion people globally suffer from hypertension. So and also leads to hypertensive heart disease. So again, let me just reset the room a little bit before we go further. We go to the next question. Again, we would like to welcome the viewers. Thank you so much for watching us go live. We're with Dr. Nik, and today we are talking about hypertension. And also about the heart, which is the hypertensive heart disease, which is a result of not doing anything with your hypertension. So basically, that's it lah. So we would like to know your questions. If you have any questions at all, please let us know down below. And also, if you have missed the beginning part of our live, you can always watch us on YouTube. We have a YouTube channel, Maaedicare. You can find us there, and also you can watch us this volume of Go Live with Doctor. Okay, Doctor, we've covered. Okay, so what are the treatments that? So what are the medications? Because we've talked about a little bit about medications for hypertension. So how about like hypertensive heart disease? What are the medications that are used for hypertensive heart disease?
Okay, they basically they have different categories. I mean, people with hypertension, let's say if they sit together and they started to compare medication, more or less they will get some will get one category of medicine, the other will get other categories. So I think a lot of people are curious of what are these medicines doing actually. Why are they not getting the same medication? So basically there are certain medication when eaten, they help to expand the blood vessel. So this will create some sort of more relaxation for the patients when they take these medicines. The blood vessel will expand and the BP will become lower. And then there are some medication that help to help you pass more fluids out of your system. So these patients, when they take medicine, they tend to pass urine more. And then usually we give it to those who have already seen some sort of edema on the feet, on the hand, where this I think in Malay they call it bengkak air. So edema is something that you can see usually at the lower extremities, where the legs become swollen, and when you press it, it sort of stays there because of the fluid retention. So these people usually get the medicine that can help them pass urine, pass the excessive fluid out of their system. And then there are those who are the medication that help to relax the vessel without really expanding them, just to help smoothen the flow of the blood inside the blood vessels. So these are basically what we are giving to the patient. And there's another one, they help to slow down the heart rate. So we tend to feel a bit more relaxed. So this usually we give to those who have heart rate higher than usual, or those diagnosed with a persistent rapid heart rate, like atrial fibrillation, or those even those with anxiety. Sometimes we do feel it to help them relax. And for certain procedures that we are doing in the heart center that requires them to have a low blood pressure and to reduce their stress as well, so we do give them this medication as well to slow down the heart rate.
Yeah, because the heart, technically has swollen.
Yeah, so you don't want to overburden them anymore
Right.
than you do. Yeah.
Okay, so how do people actually manage the symptoms if they have this hypertensive heart disease, doctor?
All right. Okay. So it's back to what are they having in the first place? Let's say for those who have heart failure, they couldn't walk several steps without stopping to catch their breath. So usually we assess them and we see whether there's any fluid retention. So if there's fluid retention in the limbs, most of the time there is fluid retention in the lungs as well. And then we know the heart is already overburdened. So we give them something to help squeeze the fluids out. And then after the fluids are excreted out, if the symptom gets a bit better than before, then we manage them slowly in terms of whether their sugar is controlling, we target as well. And then if let's say the cholesterol is high, then we target on that as well. And then let's say if their diet is basically unhealthy, then we try to shift it to a more healthy diet, less salt, less carb, less sugar. Maybe if for some cases, especially in those with kidney failures, they have certain amount of fluids they need to take every day. They cannot exceed 500 ml or cannot exceed 1 liter. So we make sure they adhere to that as well. So it's a bit unique to each symptom that they are having, each condition that they are having as well. And then of course, smoking, tobacco, and so if they're doing drugs, also we tell them to stop using the recreational drugs. More or less back to lifestyle medication after all the medications have been given, and still if we see that there's room of improvement, then we go back to lifestyle medication.
Right. So this goes, perhaps this is the same advice you would give if someone were to develop or suddenly realize that their BP is actually high. So would you give the same advice, or maybe perhaps there's like a specific diet that they should follow, because we really don't want to suddenly, from a high BP to hypertensive heart disease. So what would be the best advice if they realize, alamak, my BP ni asyik tinggi je?
Okay. So it's back to an individual. Let's say the BP is high, but the person is otherwise not obese. Yeah, probably they say they have a family history of high blood pressure. So we explore on that as well. Mother is hypertension, father is hypertension. So maybe it's best to start them earlier compared to those who probably don't have any family history of hypertension. And then it depends on their diet. If let's say they have higher BMI than usual, then we explore what they're eating. So if they're eating lots of carbs, then we can probably suggest there's that what we call a DASH diet, dietary advice for hypertension. So basically, it tells them for you to eat less salt, more fresh food, more fresh veggies, increase nuts and grains and proteins, and lower down on the fat and carbohydrates. So I think you can Google it. It's called a DASH diet. I just took it out a few days ago when I got the topic. So basically, it's the usual diet. I think KKM advocates suku separuh.
Yeah, that's right.
Separuh, That's actually is something that is more applicable to us Malaysians, but because most of us cannot part with our rice or
That's
carbs.
true.
Yeah, so KPM has, but instead of cutting off carbohydrates altogether, they started in a small portion, maybe just a quarter of the plate instead of the whole plate consists of just carbohydrates. Then you take something more natural, more unprocessed food instead of processed food. Like if you can have chicken and fish instead of burgers, then go for chicken and fish. And then if you can cook it more healthy instead of using oil, maybe you can use grill or roast or soup. This one will be a better advice. And you can increase the number of veggies, make it more colorful, then go ahead. That's very good as well. So this is the person with just high BP and a slightly high BMI, but otherwise they are healthy. And then if they have a tendency, let's say we see them have a high BP and then we ask them to go for certain cardiac procedures and they have abnormal ECGs, then we ask them, maybe you should need a stress test, and from the stress test we can know whether there's blockage inside the vessel of the heart or not. So each patient we will tackle it differently. There's no specific, but generally we will tell them the same kind of advice. If they're smoking, stop smoking, because it's the tobacco, it's the toxin that is causing the risk of the vessel to be stiff.
Right. Okay, so again, we would like to, we would like to ask the viewers if you have any questions at all, please let us know down below. Maybe you can share with us as well if you punya BP reading, tu bukan PNC BP reading bukan PNC, you know, like maybe some of you might have slightly irregular BP reading. So doctor, actually how frequent can we check our blood pressure checked? How often do we need to check?
Usually, I think the past when I was started practicing, and then the BP machine is not readily accessible, or is it a bit more expensive than it is now. So we suggest them probably just do it 3 times a week, similar time every day, so that we can get a gauge of this is the usual BP trend for this patient on this particular timing. And as an advice, maybe the earlier the better. Before you start the day, before you're going out of work, you check the BP first, so that we can have a understanding that, oh, this is the BP after a whole night of relaxing, instead of coming in the evening saying, oh, probably because after a squabble with the boss or colleagues or even family members. Yeah, so we want to reduce all these external factors as much as we call it confounders, external confounders.
Right. So 3 times a day would be okay. So you can 3 times a week. A day banyaknya lah. Lengoh tangan. So 3 times a week would be okay, right? Great. So as you say, doctor, maybe the best time to get your BP checked is in the morning, correct?
Yes, before you eat even.
Right. Okay. So doctor, do you have any advice or any tips maybe for people with hypertension during Ramadan period?
Okay, during Ramadan, so if you have the symptoms that I encountered as we discussed earlier, like headache, giddiness, neck stiffness, blurry vision, these are very telltale symptoms of hypertension. So if you have these, please by all means check in with the doctor, and if the doctor said, oh, I need to give you this emergency medicine to lower down the BP, hopefully you can agree with it, because it's something it's risky if you don't take it at that particular time, because the doctor wants to see whether the BP is reduced with this medication, or does he need to refer you to the hospital as well. So it might be best after discussion with the doctor, saying that if you're fasting by eating the medicine, your fast is broken, then probably it's something where we call as a darurat, instead of simply breaking fast for no reason. So so I think with medical reason, it's something that is acceptable even to the Muslim teachings. And then if you're fasting and you know your BP is high, then maybe try to go slow on during the iftar means that you just take what you need instead of buying everything under the sun and end up overeating, and then this might increase the risk of hypertension already. Whereas during the fasting period, it sort of reduce your chance of getting hypertension because of the fasting period. The body is able to relax from processing foods and things that is usually been doing for these years. So during this 1 month, it's a sort of let the body relax a bit in terms of having to generate insulin all the time to process whatever that we eat. So yeah, and then if you have medications already on board by your doctor before Ramadan, and you were advised to take it even during Ramadan, then hypertension medicine is quite safe to take. You can take it with sahur, or maybe if you feel that sahur is not convenient, you are not the person that wakes up on time. Like myself, I missed my sahur this morning.
Right.
So yeah, so you can take it during iftar. There's no issue with that, as long as you still are complying with the medication as well. And you feel that if you still want to stick with your exercise, and do it moderately as well. You don't want to tire you out during the Ramadan season.
Right. Okay, so doctor, what do you think about, there's always people circulating about the relation between garlic, lemon, right? People really like to have that concoction of like blending all these ingredients lah, apa lagi lemon, garlic, to reduce high blood. So how far is it true, or does it really work?
All right, there's no specific proof to say that it works directly to reduce hypertension. But of course, garlic, lemon, they are all very potent antioxidants. They have their own nutrients. They sort of help in terms of, let's say, if you're taking this as supplements, some sort of prevention measures, then you'll probably be on the healthy side compared to those who probably take, instead of lemon infused water, they take sweet teas, sweetened cordials, and all these juices with high content of sugar. So garlic and lemon, they're always considered as a healthy options, but they are not really the medicines that you should go for if you are diagnosed with hypertension. There's no specific proof to say that it works. Otherwise, probably if you go to the hospital, you have high blood pressure, you take garlic 3 times a day.
Yeah, lemon.
Yeah, I mean, it's easier for the medical team, it's easier for the patient as well, but it's because it's not so, there's no evidence proof medicine that says that it works directly. So all we can say that it's good. It's a good part of your diet. You can take it. There's no harm taking it. You get a healthy amount of antioxidants and vitamins from these foods. They are foods, not medicines. But not really curing in that sense if you're already diagnosed.
Right. Perhaps it's just a better alternative, rather than you want to choose something that's sweet or whatnot. So maybe you take that. Maybe it's sort of like a placebo effect juga lah kot kan. Suddenly you feel healthy drinking this weird concoction.
I mean, there's no harm. I mean, let's say if you're on a diet and then your doctor say, okay, exclude all sweet drinks, exclude all colas. Okay, you can drink plain water with a lemon infusion or put some garlic in it. Then it's actually it's healthy. Because of them taking it per se, but because they already push out all these unhealthy drinks out of their diet.
Right. Okay, then we have gone live for 40 minutes already. So perhaps, Doctor, maybe you have any last words or anything? Last words, takut je kata-kata terakhir katanya. So anything to just, conclude or wrap up this session today to our viewers?
All right. Okay. So to wrap up our session, I think if you yourself have high BP, or you have high BP symptoms that make you suspicious that you have a high BP, or you have family members who have high BP that is refusing to take the medicine, perhaps you can, after this session, I hope you can reassure them that it's okay to have them check, and let's say we need to escalate it to more further detailed testing. then by all means, please do so. Get the bloods checked, get your cholesterol, get your urines checked, get your kidney and liver profile checked as well. And then if there's any need for diagnostic procedures like ECG, stress test, X-ray, please do so. I mean, I know that some people, they don't want to know because then they don't have to worry about it in advance.
Yeah, that's true.
Yeah, but waiting for it until it comes is actually sort of like it's a bit too late for some people. They waited until it's already at the untreatable phase. Whereas if you know it earlier, you can actually reverse it earlier. You can take action, be more proactive, sort of like empowered by this knowledge to do these changes in your life. Yeah, so I think that's my advice. Get checked early. If let's say the doctor suggested that you need to do some other diagnostic procedure to screen the heart, to screen the blood, then just do it. And then if let's say there's anything wrong, you're more empowered, you're more in the position to be more empowered to take actions instead of, oh, it's already end stage, I cannot do anything, which is terribly unfortunate for some cases that we see as well.
Right. Okay, so yeah, Doctor, I forgot to share that today, 7th April, is actually World Health Day.
Yeah, World Health Day.
So
right
why do we celebrate World Health Day? Is because that it's just to raise awareness about ongoing health issues that concern people across the world. So I think today's topic is really very likely for us to be discussing today because, as we stated here, that it's actually estimated at 1.13 billion people globally suffer from hypertension, and hypertension is actually 1/3 of the major risk factors leading to heart disease, along with diabetes and also high cholesterol lah. So perhaps we hope that in conjunction with the World Health Day today, susah berpulak nak menyebutnya, puasa. So we hope that this discussion today have raised a lot of awareness to all our viewers today about hypertension and also apa disease tadi, Doktor? Hypertensive heart disease. So yeah, because I pun honestly speaking, I pun baru tahu that if we were to just not do anything about hypertension, it can lead towards heart disease. Very serious, and it's actually something that we cannot cure. So again, thank you so very much, Dr. Nik, for your time today, and of course thank you so much all the viewers today. Thank you so much for tuning into us since 1 o'clock tadi, and also don't forget to share this live video, and also don't forget to find us on YouTube, because for those of you yang lambat join, you can always watch us again on YouTube, subscribe, and also don't forget to visit our website to know more about Maaedicare. So again, thank you, Doctor. We hope to see you soon for Volume 5 pula. Okay, maybe we'll talk something about heart related. So again, thank you, and thank you, viewers. Have a pleasant day ahead. Salam Ramadan again. So thank you so much, Dr. Nik.
You're welcome. Thank you, Nani.
All right. Bye all.
Bye.
Assalamualaikum.
Assalamualaikum warahmatullahi wabarakatuh.